NEST. What is NEST? It's a very educative program asking confronting questions facing us as a nation, seeking relevant answers as to what we need to do together as a nation moving into the future. Today, the whole world is calling for leaving no one behind in the Sustainable Development Goals. And we're asking the question, how do we move forward without leaving people living with HIV and AIDS behind? And this afternoon, I have as my guest the Acting Director General of Ghana AIDS Commission. He is here to help us understand where we are as a nation when it comes to reproductive health and HIV and AIDS, and especially where we are as a nation the matters of HIV and AIDS, making sure that we are not leaving anyone behind. My guest is Mr. Kwabena Atuahene. Kyereme Atuahene. So, welcome.
Thank you.
To What is Next. Mr. Atuahene, help my guests, my viewers, to know a little bit about you.
Right.
Who is Mr. Kyereme Atuahene?
Yeah, Kyereme Atuahene comes from Wenchi in the Bono region. I grew up in Wenchi until I went to university at Kwame Nkrumah University of Science and Technology in 1989, and from there I moved from Wenchi, but my early years were all in Wenchi.
Yeah. And maybe growing up, what are some of the values that have kept you, either your professional life, your worldview towards society and others? What are some of the key values that have shaped you?
Right. Growing up in Wenchi, there were not many people who had advanced in education. At my generation, we didn't have many role models. But I observed that my father is a cocoa farmer and he's an illiterate. But I realized that all his brothers and sisters had been to school, and some were doing very, very well. And he had cousins and uncles who were in good jobs. They are either UAC manager or lawyers or doctors, judges, but he never went to school. Of course, he is the eldest among his siblings. So I kept asking myself, what makes the difference between my father, who works so hard but earns very little, and the others who come, from Accra, Kumasi, and other places, and we have to wash their vehicles. We even took pleasure in doing that without getting anything from them. And I realized it was only school education that made the difference. So I made up my mind that I'll go to school and to the level that I would be able to reach. So I went to secondary school in Wenchi, Form 1 to 6th form. Then from there went to University of Science and Technology at that time. So my values have been, education has been something that I really cherish. But when I started secondary school, I became a Christian. And I spent most of my time doing God's work in schools, in villages. So before I finished O-level, I thought I was going to be a pastor. In fact, I was going to be a pastor. Then one of my friends, he's a doctor now. He has a hospital in Tamale. And getting to, I think, just 1 month to the exams period, he asked me, Kwabena, I don't see you learning, but exams are approaching quite quickly, so you have to learn. I said, oh, I don't need certificate for anything. I'm going to be a pastor. He said, no. If you can make it to the university, so why don't you go to university and become a better pastor than if you didn't have a university education? I said, are you sure? He said, yes. So that is when I started preparing for O-level. So just within 1 month, I had to prepare and take the exams. And by God's grace, I had the passes that took me to sixth form. But of course, my values are founded on Christian
values,
principles.
And you still cherish education.
Exactly.
Now, Mr. Atuahene, when I was getting ready for today's program, this session, I went to some friends who are living with HIV and AIDS, hoping that I'll get some on this platform. Next Sunday is World AIDS Day.
Yeah.
And so on this program, apart from having you as the acting director general, Ghana AIDS Commission, I wanted somebody living with HIV and AIDS. I've made effort, and almost all the people I know, friends living with HIV and AIDS, turn me down. My question is, why is it difficult to get people living with HIV and AIDS going public?
Yeah, well, that is one of the challenges we have in the country, and it can be traced to the early days of the epidemic. The first cases globally were identified in the US, and it was associated with men who had sex with men. And so the initial impression was that, oh, this is a gay man disease. And that is how the stigma started. And they gave it all kind of connotations. And then coming to Ghana, the first cases that were diagnosed in Ghana were among people who had traveled outside the country, especially women who practice prostitution in Cote d'Ivoire and other countries. And so in Ghana too, it became a disease of prostitutes, which meant that people who got the disease were promiscuous or were prostitutes. And so from there, the stigma started. And is continuing up till now. Although these days you don't hear people saying that it's a disease of prostitutes, but the notion that it's only people who are promiscuous or do bad things, if I should put it in that literal sense, are the ones who get infected. And therefore, those who know they are infected, but think that their risk is so low and shouldn't have gotten it, find it difficult to go public. And it's a challenge for us in the in managing the HIV program in the country, because stigma and discrimination associated with the disease drive people underground. And so they wouldn't want to test for HIV. And even when they test, they deny. There are many people...
When they are told they are having
yes.
The virus, they deny.
Yes. There are many people who are in denial. So they will say, oh, I don't think I have it. It's not true. And therefore, some will do the test multiple times, go from place to place, just wanting to hear that from a lab technician that, oh, you tested negative. But what we should recognize is that before, if a person tests for HIV in a recognized health facility, the test will be done twice, Even now we have added a third one just to confirm. So when a person is told that he has HIV, obviously that person truly is positive, except in rare cases where we find false positives, and that may be related to other factors, not the test algorithm. And so we just want to encourage everybody that HIV affects everybody in this country. We have every group in the country has somebody who has HIV. So if you take, let's say, chiefs, we have chiefs who live with HIV, lawyers who live with HIV, media men and women who live with HIV, even pastors, if you forgive me, and bishops who live with HIV, rich men, politicians.
You are talking about Ghana, or you are talking about America?
I'm talking about Ghana. I'm talking about
help
Ghana.
my viewers to appreciate the picture of HIV and AIDS in Ghana in terms of figures, in terms of the caliber of people. What is the HIV and AIDS situation in Ghana? Because when you started mentioning lawyers, I think you were talking about America.
No.
You are talking about some countries far away. So what is the HIV and AIDS picture in Ghana today? Facts and figures available to you.
Okay. HIV in Ghana, as I said, affects every group in the country. So if you have HIV, you don't have to be shy about it. You don't have to feel shame about it, because every segment of the Ghanaian population is affected by the epidemic.
I want you to look straight into this camera and repeat what you have just said to Ghanaians.
Okay.
And the caliber of people you started mentioning, that they live in this country with HIV and AIDS. Just talk to us through this camera, please.
Yes, I just want to assure every Ghanaian, especially those who live with HIV, that there is no reason to be ashamed of being infected with HIV, because there are many thousands of people like you in this country. There are well-to-do people who live with HIV, and there are poor people who live with HIV. There are Christians who live with HIV, including pastors who live with HIV. There are judges, lawyers, teachers, drivers, fishermen and women, name it. Every group of people in this country have HIV among them. And so there is no need to be ashamed. The second point is also that HIV infection is no longer a death sentence, because we have treatment. Antiretroviral medicine is available and it is free. We will talk in more details about treatment, but I just want you to know that if you are on antiretroviral treatment, you will live as long as it takes, and you will be productive. And even if you want to have children, you can have children who do not have HIV. They will be HIV free, if only you adhere to treatment.
Very assuring. But I'll still come back to my earlier questions. What are the figures? What are the percentages?
Yeah.
Is it comfortable? Is it scaring? Can you help us appreciate where we are now? Are we winning the fight, the HIV and AIDS fight, or we are losing the battle?
As a country, we have, as at the end of 2018, we had HIV population for all ages. There was about almost 335,000.
335,000 Ghanaians living with
who live with HIV, or let's say 335,000 Ghanaians and foreigners who are resident in Ghana live with HIV. And so you are just one only one of those 335,000. So why should you be afraid? Sorry, why should you be ashamed about it? You are not alone. Now, of this 335,000, we have 117,199 being males, and females 217,500. That's
so more women are having the virus.
Women are about 65% of HIV population in the country. Children, that is children aged 0 to 14, was 29,514, which is about 9% of the total number of people living with HIV in the country. Now, new infections. You ask whether we are doing well or not. Usually we talk about
before we go to new infections, you said 0 to 14.
Yeah.
We have how many of them?
That's about 29,000.
But why? They, at that level, many of them are not sexually active.
Yeah.
So why should 0? It means you can have 1 year old living with the virus.
Yes.
Why?
Even less than 1 year.
Why?
Is true. Most of these children, 14 years and less or below, most of them were born with the disease.
Oh, okay.
Through mother-to-child transmission. And so we have quite a number of such children. Some are even now grown up because HIV started in Ghana in 1986. So you even have some of them who may be above 30 years, who got the infection not through sexual contact, but through mother-to-child transmission. So why would anybody stigmatize such a person? It was not out of his or her fault, So, and it can happen to anyone. Yes, but
you started talking about new infections.
Yeah,
and let's hear more about that.
Yes, so new infections.
Where are they coming from?
I'll talk about that.
Okay.
When we talk of new infections, we mean the number of people who newly got infected within a given period of time. So now we are talking about 1 year, and specifically 2018, the year 2018, 19,931 people got infected in that year. Now, of this number, we have about 16,614 being adults, age 15 to 49 years.
15 to 49.
Yes.
Very active
population. Yeah.
And you said the figure there, the 15 to 49, how many people are?
16,614. Children 14 or below, or 14 years or younger, 3,317 got infected. And again, I need to stress that most of them probably may have been infected through mother-to-child transmission. But when you come to young people age 15 to 24, about 5,532 people got infected, actually representing 28% of the total new infections in 2018.
28%.
Yes, so nearly 30%.
The young, active population.
15 to 24.
15 to 24.
Yes.
Ghanaian youth. And it's been so for a number of years now, from 2014 till now. The new infections among young people within that age range, 15 to 24, has averaged around 5,500 or more, which is quite worrying.
and is rising steadily. But as a country, we have over the last 10 years reduced new infections by 22%. But the 22% is not significant enough to bend the epidemic curve. Now, government has committed itself to eliminating AIDS in the country. And that will mean that we should be able to reduce new infections. We want to achieve epidemic control, which means we don't want HIV and AIDS to be public health threat anymore. And by the Sustainable Development Goals, we should achieve that by the year 2030.
Okay.
But we believe we can achieve it much earlier, before the year 2030. And so if we can do that, then it will be the best thing that must happen to Ghana. And I believe we can do that. But I just want to emphasize the point that new infections have averaged about 20,000 over the last 6 years or even more.
New
infections.
People who are now contracting the virus.
Annual average is around 20,000.
Every year.
Every year.
The number of Ghanaians
who get infected.
But Mr. Atuahene, now it's like the HIV and AIDS campaign or public education. I don't know, but this is from where I stand. It's like it's no more a serious issue in this country. It's no more the way you are, the figures you are giving me. It's scaring, but that is not the impression I get out there.
Yes.
If 20,000 Ghanaians get infected every year,
yes,
it's a serious thing. But when I go out there, when I go to church, when I listen to radio, I watch TV, now HIV and AIDS doesn't suggest to me that it's a threat to this country.
It is a threat because the more your new infections go up, the more HIV population you add on. And so, as a country, we are determined to reduce new infections to below 1%. That is our target. And if we are able to achieve that, and then AIDS-related deaths also move down to less than 1%, then we can beat our chest to say that we have achieved epidemic control. Now, it is possible to achieve epidemic control and reduce new infections to below 1%. First, the 335,000 people who live with HIV, if they all begin to take antiretroviral medicines between 6 months to 12 months, they will become virally suppressed. What that means is that antiretroviral medicines actually suppresses the virus.
Okay.
It prevents the virus from multiplying itself. And the multiplication is usually in billions, within a short time. And so the medicine is able to reduce the number. And when the viral load goes down to, let's say, 1,000 copies and below, then we say the person is virally suppressed. And that can only happen when the person consistently adheres to antiretroviral therapy. And when that happens, when he becomes virally suppressed, he cannot transmit the virus to his partner.
I'll come back to the medication. Viewers, I'm in a conversation with Mr. Kwabena Kyereme Atuahene. He's the Acting Director General, Ghana AIDS Commission. And he's giving us some scary figures when it comes to HIV and AIDS in this country. It seems for some time now we are all going to bed as if HIV and AIDS is far away from us. But with what he is telling me, we are not out of the challenges, the trouble of HIV and AIDS yet. And you're on GTV, the authentic and trusted voice of this country. Now, Mr. Atuahene, you said it's possible to reduce mother-to-child transmission, and now some of the things you are telling me earlier on, that if you take your medication and all that, you can suppress. Is HIV and AIDS medication, is it affordable? You have told us earlier on that now we have even pastors, chiefs, lawyers, but we have also poor people. So maybe the upper class people can afford. Is HIV and AIDS medication, is it affordable?
It's actually free.
Free means what?
Free means
I can walk to any pharmacy shop and collect it?
Yes, not pharmacy shop. HIV medicines are program medicines,
okay,
which means government has made it, a point to, or the commitment to ensure that it's available, accessible, and free to everyone in health facilities. So you can only get it from health facilities.
Okay.
We have more than 500 health facilities across the country where you can access antiretroviral medicines. And these facilities are mostly the district, regional, and teaching hospitals. We have other health facilities that are not necessarily district hospitals, like polytechnics in many towns and cities are also providing antiretroviral medicines. So we have as many as 500 facilities where anybody can get free antiretroviral medicine. How
does it work? I just walk in. If I have a son, a daughter, a church member, they just go there and collect it. Or how easy or how difficult it is when I get to the hospital?
It's not difficult at all. Now, before they give you, it's a medicine for treatment of HIV. And so they have to first determine whether you have HIV. And if you have already tested and they know that they have the records to show that indeed you've been diagnosed, then they will give you the medicine. Usually when you start, they give it, you have to take 1 month, the amount of drugs they will give you will take you, let's say, 1 month, and then you have to come back because the doctor has to monitor you and make sure that everything is okay. If he has to change the medicine, he will do so if you are having any challenges or problems with the medicine in respect to side effects. If everything is okay, usually within 6 months, between 6 and 12 months, people become okay and become virally suppressed. And at that time, you don't need to see the doctor as frequently as you used to. And so he will maybe give you about 3 months, to return. So you go home with the medicine you need for that period. And when you become so stable and you probably have to see a doctor only for him or her to see your lab results relating to, usually they'll have to do some monitoring through, lab investigation. So you go to see him maybe only once a year, okay? Because we don't want people who don't need to see the doctors to also add up to the numbers. The caseload in some of the clinics is very high, and so that is intended to free up the doctors and the nurses to concentrate on newly diagnosed people, and that is working in many of the health facilities. I'm interested
in this mother to child because now you are telling us that you can have as 0 1 year old Now, do we have medication also that can help children, not having the virus? Is it possible?
Mother-to-child transmission should not presently be happening, but it happens because we have many pregnant women who do not deliver in hospitals. Even these days, it's sad to say, and it hurts me, I say it with a lot of pain, that we see a number of pregnant women electing to deliver or give birth in chapel houses or prayer camps. Now, that is a major challenge for us as a country, and I believe the Ghana Health Service and Ministry of Health are actually working to tackle this problem. And so, because people are not delivering in hospitals, they are missing the golden opportunity to have HIV-free children or babies, because we have the treatment that would ensure that the mother who lives with HIV can have a baby who is HIV-free. We have medicines for the babies that is given to them after birth, and they have to do some tests. We go through, so we have a whole mother-to-child prevention of mother-to-child transmission program in all the antenatal health clinics or centers. So midwives have been trained, some nurses have been trained to support, pregnant women and and mothers who live with HIV. So no child should be born with HIV. And the First Lady, in conjunction with the Organization of African First Ladies, has initiated Free to Shine campaign. The campaign is aimed at eliminating mother-to-child transmission in the country, and I would want to encourage every mother, every woman to be part of this campaign. And whenever you are pregnant, just go to hospital, make sure you attend antenatal clinic. They will test you for HIV. Of course, you have to accept the test. They will ask you if you want to test. If you accept to be tested, they will test you. If you have HIV, that is not the end of the world. So just adhere to the advice of the midwife or the nurse or the doctor who, provides the service to you. And you have self-delivery and have HIV-free baby.
But do we have laws in this country protecting people living with HIV and AIDS? If I go to my place of work, can I just go and tell everybody, hello everybody, I have HIV and AIDS. I'm HIV and AIDS positive at the workplace, and I will still be accepted? What about if they get to know and they throw me out? In terms of workplace and other places, people living with HIV and AIDS, are there laws protecting them? Disclosure, are they being forced to disclose their HIV status?
There is a law, the Ghana AIDS Commission Act 2016, which is Act 938, actually makes HIV stigma and discrimination an offense in this country, and is punishable by law. A person can go to jail or be fined or both. So under no circumstance should anybody be discriminated, and the law is quite detailed. So with respect to the specific issue you raise, at the workplace, the employer cannot use a person's HIV status to determine whether or not the employee must be, or a person must be employed, promoted, or dismissed. HIV zero status must not affect any of such decisions. And so it is wrong and against the law. It's a criminal offense for any employer to sack anybody or to say that, okay, we are recruiting and you have to go for HIV test, and if your test is positive, we cannot engage you. That is an offense of the law. And if the person approaches Ghana East Commission or wants to take that matter up with the law enforcement agencies, he is within his rights to do so. And if it comes to our attention, we will support such a person to assert his rights within the law.
Now, in terms of platforms for partnerships, where are we? Previously, there were so many NGOs, churches, Muslim, even Ghana Police Service, so many people, media, platforms, everybody talking about HIV and AIDS. Now you are the man in charge. Who are the partners? Is there a fatigue? Are they tired? Or the enthusiasm is still there, but maybe some people are not appreciating it?
Yeah. I like the word you use, fatigue. Yes, I call it complacency. We are very complacent as a people, as a society, as a country, when it comes to matters of HIV. The churches are no longer talking about HIV. It's as if it's gone away, and we know it's no longer an issue. Probably because we don't see people with emaciated bodies like in the beginning, when many people living with HIV actually had disease progression. And so because of that, maybe they think HIV is not a problem, but HIV is a problem. And if you permit me, I would like to share this information with you and Ghanaians. Yeah. According to the Ghana Demographic and Health Survey of 2014, people living with HIV in Ghana are mostly Christians. Yes.
Mr. Atuahene, you are talking to me. I'm a pastor, if you don't know.
That is why the church must take very serious interest in HIV and the people.
Wait. I'm a Presbyterian pastor. My name is Reverend Opuni Frimpong. I'm the former General Secretary, Christian Council of Ghana.
Yeah.
I teach religion at KNUST, Department of Religious Studies. Repeat what you just said.
Yes.
And let my viewers hear you very well. And I didn't hear you well, and okay. you are destroying something for me in my stomach.
Okay.
Look straight into this camera. Repeat what you said. I want to be sure I heard you.
Reverend, you may not want to know, but according to the Ghana Demographic and Health Survey of 2014, of the number of people living with HIV in Ghana, 80% is in the church.
80%?
80%
of people living with HIV and AIDS in Ghana?
Yes, 80% is in the church. Now I can give you the breakdown. People who were tested in that survey for HIV, 3.4% was reported that they belonged to Catholic. 1.2% belonged to Orthodox churches. 4% Pentecostal and Charismatic churches, and that's the highest. The other 4% is actually people who have no religion. 3.3% other Christians. Muslims, less than 1%. It's actually 0.8%.
Viewers
and traditionalists.
Yes,
it's less than 0.1%.
Viewers, it seems, and this is the man. He is the acting director general, Ghana AIDS Commission, and colleague church leaders and members. We need to hear him. How many times? Because what I'm hearing, I'm very scared that 80% of people living with HIV and AIDS in Ghana are in our churches. And he has given us the details. The Catholic, the mainline churches call it Orthodox Church, Pentecostal, Charismatic, and church leaders. It seems to me we need to roll out a new program responding to this 80% that we are hearing. They are in charge, yes, but the people are with us, and we don't have any excuse. He mentioned also Muslim, even though the percentage there seemed to be a bit lower, but even if it's 1%, my friends in the various Muslim groups, you can also not go to bed. We should not wait till your figure become very disturbing. Traditionalists, but at least church leaders, we must quickly strategize for the 80% that the acting director general of Ghana AIDS Commission publicly on GTV live program is telling us, and he can't lie because the camera is on him. Mr. Atuahene, how do we come on board? How do you get everybody, Muslim, traditional leaders, but especially church people? Because now you are telling me that 80% of people living with HIV and AIDS are in my church and other churches. What is your program for all of us to fight this battle together?
So I first have to say that these figures are put out are verifiable.
Oh, okay.
Just look at the DHS and you will see that it is truly the case. I'm not putting these figures out to scare anybody, but just to emphasize the fact that we cannot continue to be complacent, especially the church cannot continue to close its eyes on HIV. Why? Because the people who live with HIV in this country are in the churches, and therefore the commission wants to partner churches, wants to partner Muslim groups to fight this fight to the end. We are committed to changing this trajectory, changing this narrative to ensure that HIV no longer remains public health threat in this country. And the church must come up with policies to ensure that church members living with HIV are accepted and embraced and not stigmatized. Stigmatization is so pervasive in the church, and that has to stop. And we can stop that by working in partnership. Ghana AIDS Commission's motto is working actively and in partnership to eliminate HIV and AIDS. So the church is our partner, the media is our partner, the Muslim groups are our partners, businesses, enterprises, you are our partners, NGOs, you are our partners, traditional leaders, chiefs and queen mothers. Let's do the same as we used to do decades ago. If we do not work together in that way, in a multi-sectoral approach, we are not going to achieve the goals that we have set for ourselves to eliminate HIV and AIDS in this country, to achieve epidemic control. And we cannot do that if we continue to remain complacent. We should, gird up our loins and begin to work together and to fight to reduce new infections and reduce AIDS-related deaths and keep people living with HIV healthy, productive, and productive. And it can be done.
It can be done.
Because as I was saying, if all the 335,000 people living with HIV are on antiretroviral medicine, they will remain healthy and productive. So the economy will grow. And they will make money, take care of themselves and their families. Secondly, they will become virally suppressed, and therefore they will not transmit the virus. So if everybody is on treatment, within 1 year, we should have our new infections, which is about almost 20,000 by the end of 2018, coming down all the way down to about 1% or less.
That's amazing.
We can achieve this within a very short time.
We
don't have to do much. It's all to have people living with HIV to be on treatment. Now, why is it a problem now? The 335,000 who live with HIV, only about 185,000 have tested and know their status. So we have about 150,000 who have not tested.
And they are around.
They have HIV, they don't know they have it, and they are spreading it. And of the 180,000 who know their status, only 136,000 currently on treatment, which means more than 50,000 of them who have tested and know their status are not on treatment.
Mr. Atuahene, next Sunday is World AIDS Day, December 1st. Now, this is what is next. These are the questions we are asking. Do you have a message for Ghana? Do you have a message for young people, mothers, our politicians? And in fact, you've talked about even church. And next Sunday, as we go to church, you are telling me that 80% of people living with HIV and AIDS, next Sunday, December 1st, 80% are in the churches. If you have a message, will you use our platform to talk to everybody so that at least, and even invite all those who should be part of December 1st, next coming, today is Thursday, Friday, Saturday, the whole world is celebrating not good things, but drawing attention, that we must accelerate the promise to get everybody on board. If you have a message, use our platform, What Is Next, to talk to the nation, please.
Thank you very much. Yes, the World AIDS Day is 1st December, and the whole world is commemorating World AIDS Day. And we join the global community to do so in Ghana. The National Durbar will be held at La Trade Fair Center, and many people are coming, and therefore you are also invited to be there. Or anybody who is interested can come to La. We start at 8:30, and latest by 11:30, 12 will be done. It's going to be a short program, but very impactful and intense. Now, we have a message. The Commission has developed a common message that should be read to churches, the congregants, the mosque. Friday, tomorrow, we are going to do Muslim worship at the police mosque. And we are sharing this with Christian churches and Muslim groups to really read this message to their members so that they know what they have to do. And the message is very simple, and it's also going to the media. On Sunday, 1st December, we want the media, the churches, to read this to the communities and to our congregants. The key messages are that we want to eliminate HIV or new infections in this country, in partnership with the churches, with mosques, media, businesses, and every group in this country. And the message is very simple. In 2018, 19,931 new infections occurred in Ghana. Of this number, 16,614 were adults aged 15 to 49 years, while 3,317 were children 14 years and younger. A total of 5,532 new infections occurred among young people aged 15 to 24 years. The major causes of HIV infection include risky sexual behaviors such as unprotected sex in multiple, concurrent, and casual sexual relationships. Sexually transmitted infections, use of unsterilized sharp objects, and mother-to-child transmission, which occurs during pregnancy, delivery, or breastfeeding. Since 2010, Ghana has made consistent progress in reducing new infections in reducing new infections by 22%. This reduction is not significant enough to bend the epidemic curve, especially as new infections have remained quite high, averaging 20,000 annually. Ghana is committed to eliminating new infections, including mother-to-child transmission of HIV, and this calls for concerted efforts by all social groups in the country. Faith-based communities and the media, due to their large followings and influence, have the capacity to reach out to many Ghanaians with information that will lead to reduction in new infections in the country. And we have specific messages on HIV prevention, for example. And we are saying, with regards to HIV prevention, it is important to go to HIV health facility for HIV test to know your HIV status and that of your partner. Having sex at an early age exposes a young person to getting HIV, sexually transmitted infections, and early pregnancies. Having sex with multiple partners increases the risk of HIV infection. Abstinence or being faithful to your uninfected partner are effective HIV prevention methods. Message of HIV on HIV treatment. If your HIV test is positive, you ought to visit a health facility and start treatment immediately. Taking your medication consistently reduces the amount of virus in your body, promotes good health, and prolong your life. ARVs are free, that is, antiretroviral medicines are free in all health facilities. Message on eliminating HIV-related stigma and discrimination, which you mentioned earlier on. HIV-related stigma creates barriers to HIV testing, treatment, care, and support. HIV is a virus, and anyone can get it. Anyone can get infected, and therefore there is no reason to stigmatize. So stop stigmatizing persons living with HIV and treat them with dignity. The last message is on eliminating mother-to-child transmission. Expectant mothers should attend at least 4 clinic visits during pregnancy and deliver the baby in a health facility. The first visit should be as soon as a pregnancy is detected. Encourage all expectant mothers to support the Free to Shine campaign. With medical interventions, a mother living with HIV can give birth to and raise an HIV-free baby. Communities to support pregnant women by ensuring that they attend clinic before and after childbirth. Thank you.
Now, just within 2 seconds, your last words to my viewers.
My last words are that everybody has HIV status. You are either negative or positive. If you don't know, this is the right time for you to know. HIV test is free. Free in every more than 3,600 health facilities across the country. Walk to any health facility and have free HIV test. If you test negative, continue to do the things that keep you negative, which means protect yourself. You know the modes of transmission: sexual contact, using unsterilized sharp objects. If you are able to protect yourself, remain faithful to your uninfected partner, or use condom anytime you have sex with a person whose status you don't know, you have effective prevention. And if you have HIV, that is, if you test positive, that is not the end of the world. Just seek treatment immediately from any health facility, and treatment is free. Thank you very much.
Viewers, I've been in conversation with the Acting Director General of Ghana AIDS Commission, Mr. Kwabena Atuahene Kyereme. I've been confusing whether the Kyereme come first or the...
It's my first name.
So Kyereme Atuahene. Yeah. And he has given us some insight, especially the number of Ghanaians living with HIV between 15 and 40, the active population. The figures are scary. But what has come to me as a shock today is for the man in charge of the HIV and AIDS fight in Ghana telling me on this platform that with the number of people living with HIV and AIDS, 80% are in our churches. We boast about a number of churches and Christians in this country. Now HIV has also come to the numbers. So yes, we have 70% Christian Ghanaians, but now you have 80% Ghanaian living with HIV and AIDS also with us. This is a call to all church leaders in this country. It's not only for the churches, Muslim leaders, traditional leaders, all of us as a community must come together. But maybe with these figures, church leaders in this country must lead the fight. We must come on this platform of partnership and make sure we protect mother to child transmission and protect our young people. This is what is next. Our hallmark is the common good, and we are on GTV, the authentic and the trusted voice of Ghana. May God bless our homeland Ghana and make this country great and strong, and make this country HIV and AIDS free country. We'll come your way next week, God willing. Till then, let us be one another's keeper. This is the only country we have. Let's make this place the best place for everybody. God bless you. Have a good evening.